Thank you. So today I'm going to be talking about a retrospective study that we are doing right now to evaluate the targeting feasibility of osteomyelitis using magnetic resonance guided focus ultrasound. So osteomyelitis is an infection of bone and surrounding structures that generates an abscess and significantly increases the risk of limb amputation. If we talk about diabetic patients that have 10, 20 times more chances worldwide of limb amputation, this disease is even more alerting. Traditionally, it is treated using a combination of antibiotics, bedside debridement, and surgical interventions when necessary. Our final goal is to use magnetic resonance guided FUS, more specifically the Sonolive system, in combination with antibiotics to increase the immune response and the antibacterial effect at these infection sites. But first, we did this retrospective study to perform a virtual treatment planning of patients previously diagnosed with osteomyelitis. So we went to the Thunder Bay Regional Health Science Center health records, and we look at cases of patients previously diagnosed with osteomyelitis, at least 18 years old, that had either CT or MRI images available at the infection site. Then a radiologist reviewed those cases to see if they would be potentially feasible for this study, and we came up with 4 exclusion criteria. First, if the target was less than 1 centimeter away from the skin to avoid any kind of skin burn, if it was too close to a neurovascular bundle, if there was any kind of defect in the overlying skin, and we couldn't reach the target from a different angle, and 4th, if there was a metallic device in the way or close to the target region. Once we had these images read, we ran them through a Python-based software script, so we could recenter the data set based on the infection location. For the CT images, we also used a dummy MRI file, so we could trick the Sonolive platform to do the treatment planning. Some cases, we also did the rotation of the data set to simulate a different position than the one that the images were acquired. Once we had those images processed, then we did the virtual treatment planning at the Sonolive treatment platform. In order to get the quantitative results of our study, we also calculated the total target volume of the infection using a volumetric reconstructions of regions of interest using the software Osiris, as you can see in the picture. Here I have an example of one of the virtual treatment planning that we performed of patient 20 that had an infection in the left knee. And for this case, we could reach 99% of the volume of the infection. So far, we have reviewed 75 cases, and at this moment, the radiologists decide not to go with the spine case. 25% of these cases were disqualified, most due to criteria 1, that was the proximity to the skin. For the cases that we could treat at least in part, the volume target was 92.55% in average, 5.3% standard deviation. Some of the conclusions that we can take away from this study is that this is the first step to demonstrate the feasibility of treating osteomyelitis using magnetic resonance guided FUS, using a Health Canada approved system, that's the Profound Sonolive. And again, if we look at patients with associated comorbidities, such as diabetes, this would have even more potential benefits, since we could potentially avoid many cases of limb amputations once we reach our final goal. I'd like to acknowledge all of our sources of funding, and thanks for your attention.
Questions? So, one for me. You mentioned this was the first step before doing a treatment. The treatment is an ablation treatment to sterilize the infection, or is it a hyperthermia treatment to increase blood flow, or a little bit of everything?
So we have some preliminary study that we induced abscess in mice, and then we use a thermoablative temperature, and we did see an increase in the antibacterial effect 4 days after we had the procedure. So a priori would be ablation, but at this moment we are not 100% sure.
And this was done in combination with?
In combination with antibiotics.
Antibiotics.
Yes.
Okay.
you said that a skin defect was a contraindication, an exclusion criteria.
Yes.
Yeah? And you said that you wanted to treat diabetic feet, but virtually every case of osteomyelitis in a diabetic foot is associated with a skin defect. That's how it becomes osteomyelitis. So how do you reconcile those two?
Yes. So, for example, the patients with the infection in the feet, they have a defect in the overlying skin on the superior position, and then we rotated the images to have the patients with the foot touching the MRI base.
You go from the other side, is that what you're saying?
Like with the knees bended, touching the MRI base, and we could reach from the bottom.
Okay, got it.
Yes.
Right. And do you have any experimental evidence at all to say that this is an effective strategy?
So as I was mentioned, yes, we had experiments, but with just the abscess, an abscess in the case of osteomyelitis, and we did saw some positive effects after 4 days of the treatment planning at ablative temperature. In the future plans of this research, we intend to induce osteomyelitis in large animals so we can see the bone itself. But we are very optimistic about this approach.
Thank you very much.
Thank you.